In the era of COVID-19, thinking of medications, availability, and accessibility usually calls to our minds an endless flow of ideas and words, as fear and hope, urgency, efficacy and safety, fake or standardized, health versus economics, trade and industry, private or public, national versus supranational. I am Dr. Ahmed Safwat, board member of General Authority of Healthcare Accreditation and Regulation, Gahar, Egypt. Gahar is the highest independent national body which is responsible for developing the national healthcare standard and ensuring compliance of all healthcare facilities with them. Gahar reports directly to the President of Egypt. Originally, I am a consultant neonatologist with about 20 years of experience in healthcare with a strong academic and practical background regarding standard development and validation, clinical governance, organizational analysis, strategic leadership, performance improvement, change management, and accreditation design and support. Let us start from the start, starting from pre-COVID-19 situation. It was already estimated that about 2 billion of people lacked regular access to essential medicines, and we will talk about essential medicine later on in this speech. Most of them in low and middle income countries. Improving this gap is a long-standing global public health priority associated with achieving the universal health coverage, one of the SDGs. So what happened with COVID-19? The COVID-19 pandemic actually is putting huge strain on healthcare systems worldwide. Several developed countries like US, UK, Italy, Spain have had to recruit retired health personnel to help. Even United States has contracted car and weapon manufacturers to provide ventilators. More than 80% of ICU beds in Italy were occupied with COVID-19 related cases. So what is the situation in low and middle countries? Low middle income countries, healthcare systems are especially challenged because of the effect of this pandemic is having on the already weak health systems. It's not only that, we are not talking about COVID-19 medications. We are talking also about other medication, especially the chronic diseases medication. When I'm talking about chronic diseases, I mean chronic infections and non-communicable diseases. It's like HIV, TB, hepatitis, diabetes, cardiovascular, cancers, etc. People with chronic cases are more vulnerable to COVID-19, and also COVID-19 worsens chronic cases. That means also we are facing challenges with chronic disease medications. So we don't have challenges with COVID-19 related medications only, but also chronic diseases medications should be considered in the pandemic as well. So let us get closer to pharmaceutical trade and industries in Africa. Most of the African countries are in their very early stages of pharmaceutical development. Most of them import drugs, raw materials, and equipment from countries outside the region, especially China and India. Almost all local drug manufacturers in Africa purchase active pharmaceutical ingredients from other manufacturers and formulate them into finished drugs. A majority of countries in Africa are limited to direct purchasing of medicine and other finished drugs in bulk, then repackaging them for local use. And only very few pharmaceutical companies in sub-Saharan Africa engaged in significant research and development and manufacturing active pharmaceutical ingredients. Also, we need to add to that as a sequence of legitimate supply chain being blocked, as many countries have already banned or significantly limited export of protective equipment, medical devices, and medicines related to COVID-19, the risk of falsified and substandardized medicines grows. European Medicines Agency and the WHO have issued warnings about the increase of falsified medicines and testing kits, claiming to prevent, detect, and even treat COVID-19. It includes online frauds, sales of unapproved products on e-commerce platforms, social media, and illegal online pharmacies. The risk of fake medicines is not limited to COVID-19 related medicine, but extends to other drugs, as there is a shift in the restrained import of pharmaceuticals toward battling the current COVID-19. So after this very dramatic introduction about the situation and situation analysis, what should we do right now? Actually, I've summarized my recommendations, or even you can say hopes, for what should be done in about 8 important points. The first one is we need to develop an essential medicine strategy. And according to WHO, that essential medicines are medicines that satisfy the priority health needs on population and should be available in the health system at all times in adequate amount with quality ensured at a price that individual and community can afford. Essential medicine lists should be developed first, then regulation that ensures access to essential medicines is not interrupted at all the time. So first of all, we will have the essential medicine strategy. Then we need to ensure that safety and efficacy are not bypassed under the pressure of urgency. We need to have clear and solid and consistent mechanism for that. There is also a need to raise and manage legitimate concern about power and influence of pharmaceutical companies for systematic bias, or I can say for potential systematic bias within research and development process. Also, it is the time to raise the urgency of ensuring equitable access to medicine through supranational, again, I'm talking about supranational body, ensuring that there is a system in place to coordinate rational selection, procurement, access, distribution, and use across countries. The fifth hope or recommendation is we need to have a clear mechanism for preventing stockpiling. 6, we need to ensure proactive monitoring of medicine supply. This requires pharmaceutical companies to submit drug shortage prevention plans to competent authorities. 7th, we need to ensure early notifications by companies of drug shortages at least 2 months in advance. The last but not the least is we need to enable consumers to report on drug shortages. My last words here are, please, please, and please again, do not think that COVID-19 is the real global nightmare. COVID-19 is not more than an alarm of the possible serious global nightmare if we continue doing things in the same way and expecting different outcomes. Simply, there is much more work to do and not a moment to lose. Thank you.